Good morning. Live from the HAFA office, this is Ronell Nolan, President, CEO of Health Agents for America. We're starting off Monday strong with another call to our agents to please call the senators on the Help Committee in Washington, D.C. This weekend, I received several emails from our members questioning why HAFA was on one side of this issue and NAHU was on the other. I can only tell you personally, I have not spoken to the leaders of NAHU. Those that are dual members, I encourage you to reach out and find out why they are on a different side of this issue. However, the Lower Healthcare Cost Act, Section 308, is 15 pages of regulation for agents and brokers. HAFA absolutely supports transparency. We've been transparent. We continue to be transparent. But to be included in a bill, a legislative bill, a federal bill, that is supposed to address the cost of health care, of health insurance, we are simply just not the problem. So I've come up with the top 10 reasons why HAFA supports the removal of 308. Number one, 308 insinuates that employers have not done their due diligence, nor do they know how much commissions are included or if there are any fees. You're absolutely questioning their intelligence. Number 9, United Healthcare in almost all states have removed commissions on employer groups 50 lives and above. Therefore, Section 308 requests you to report 0. Number 8, the reason this piece of the lower healthcare cost came into fruition was because of data received from a 2007 Federal Register. 2007 Federal Register outlining our commissions. That data is old. Number 7, this piece of this legislation was attributed to a ProPublica article, which did not tell the full picture, which does not show the full picture of agents and brokers and our commission schedules and how we are paid. It wasn't an article in the USA Today. It wasn't an article in the New York Post. It wasn't an article in the Washington Post. It was a ProPublica article that referenced a few brokers who seemed to have their own agenda, an agent association who I have been told wanted to retract that statement that they were included. So the article should not be included in a piece of federal legislation. Number 6, our commissions were cut 50% since the ACA, at the inception of the ACA. Number 5, commissions to date have been cut 90 to 100% on individual business. Many states, many carriers are not paying a penny. Number 4, commission schedules are dictated by insurance carriers. We do not negotiate with insurance companies how much they'll pay us. Commission schedules are dictated by insurance carriers. Number 3, commissions are outlined in the 5500. Number 2, our commissions are included in the MLR, medical loss ratio. So not only do we include them, we're transparent, we explain them, they're already included in the MLR that was put in the ACA to control how much insurance companies paid and charged. And number one, our industry is one of the most highly regulated professions in the United States. So top 10 reasons, and I'm sure I could go on. Please take a minute, call your senators that are on the HELP committee, send a fax to each one. I have been told that not every fax number is working correctly. If it isn't, go to the next one. Make sure to make a phone call for that senator. HAFA small, but we're mighty. But when another agent association is in support of regulating our industry further, and we are smaller, we're going to ask that members, non-members, staff, friends, family alike, those that know us, those that know how hard we work, those who know how much we get paid, to please call Washington, D.C. and ask them to respectfully remove Section 308. Today is the day. Tomorrow begins markup. Doesn't mean that we will stop our forward push. But you need to ask yourself, why is this in there? Why would I be okay? I'm already transparent. Why would you want to be regulated in addition to what you already are doing? And why are you included in the Lower Healthcare Cost Act? We don't belong there, we don't deserve to be there, and we need to be removed. Ronell Nolan, President, CEO, Health Agents for America, call to action. It's Monday. Let's get busy.